Welcome to a program featuring interviews of state and federal candidates, as well as the incumbents from districts served by Clatsop, Marion, Polk, Tillamook, and Yamhill counties. I'm Ruth McEwen, an advisory council member serving Northwest Senior and Disability Services Advisory Council. I want to welcome candidates, incumbents, and advisory council members to the 2022 Candidate Forum, which is sponsored by our Senior Advisory Council and our Disability Services Advisory Council. Northwest Senior and Disability Service is a local governmental organization that provides Medicaid, Oregon Project Independence, Older Americans Act, and grants-funded programs. The mission of the Northwest Senior and Disability Services is to promote dignity, independence, and health, honor choice, and empower people. The assistance and support we provide consumers include information and assistance, in-home and community-based services, and financial and medical help, meal sites and home-delivered meals, option counseling, adult protective services, Medicare counseling, peer mentoring, money management, as well as health and wellness programs. Because of the number of state legislative districts that our service area covers, we have invited a large number of candidates to be interviewed. Each candidate has been given information on the format used in these interviews. Each candidate will be introduced by a member of the advisory councils. Then each candidate will have the opportunity to answer questions which will be timed. That way you, the viewer, can compare apples to apples. We thank these candidates for their willingness to share their views about services for Oregon seniors and people with disabilities.
Hi, my name is Linda Crandall. I am a member of the Senior Advisory Council at Northwest Seniors and Disability Services. Today I'm interviewing Anthony Sorachi. He is the Democrat candidate for House District 31. We'll be asking Anthony questions related to seniors and people with disabilities. Welcome, Anthony. Thank you for sharing your time with us.
Thank you for inviting me.
The first question I have for you is, tell us about your platform and experience that would encourage a senior or person with disabilities to vote for you.
Sure. I'm running for Oregon's House of Representatives here in District 31 because I want to make sure that we have a state government and a state that continues to work for all Oregonians. I believe the only way we can do that is by making sure our government is responsive to the people it's trying to serve. So my focus when I'm out in our community, either at events or going to door to door or just running into people at the grocery store, is making sure that I'm listening to the needs that individuals have, the problems that are affecting them in their lives and what they want to see our government working on. The two things that I'm hearing more than anything else when I'm talking to folks are concerns over affordable housing and access to healthcare, especially mental health care. And these are things that affect everybody in Oregon, but folks, either seniors or folks with disabilities. Oregon's doing pretty well on a lot of areas regarding healthcare. Our access to healthcare for physical health is pretty good. We have a lot of work to do on mental health. Our mental health situation is pretty poor in Oregon, frankly. We also have a lot of cracks. Even though we're doing very well on physical health, there's still a lot of cracks in coverage that people can fall through. We need to continue to address those. The legislature has been doing a good job of tightening that up, but there is still more work to do. So I'm committed to making sure that we continue to improve this, both access to care and coverage for that care, so that nobody falls through those cracks. On housing, there's two main focuses for me. One is making sure that everyone has access to affordable housing so that they can get into a house, and particularly relevant for seniors and folks with disabilities, making sure that nobody is priced out of homes that they're already in. Changes in property values, property taxes, and mortgage rates, things like that, can be really disruptive for seniors and for our communities if we don't provide some protections to make sure that that's the case. Oregon has a very unusual land use law system that has been really successful at making sure that we preserve the character of our communities, but it also presents some challenges that we have to make sure that we're doing the smart things to work within that system to continue to get people's needs met. So that's what I'm focused on doing. I think those are things that are particularly valuable for seniors and folks with disabilities.
Thank you for that. Tell us what you know about OPI, Oregon Project Independence, and how it improves the lives of seniors and people with disabilities.
Yeah, OPI is a great program. We know that enabling people to remain in their homes improves outcomes on all sorts of different measures. It improves everything from recovery from acute illness to longevity, particularly in the face of chronic illnesses. It allows people to remain healthier and more active in their lives and in their communities. The stability that provides is also really beneficial to the broader community. So I think it's a really great program that we need to see continue to grow and provide great care for folks. My mom was always very used to being a very independent woman. When she got cancer, she needed a lot of support to make sure that she could still do that. She was able to do that through the combination of her excellent healthcare coverage that she had from her career as a public school teacher. But even so, it took a lot of support from our family. And we were lucky in that we had a big extended family nearby who were able to, and of course, happy to provide that support. But not everybody has access to either or both of those things. OPI and even when they do, we have a community response to make sure that we're caring for people when they need it. OPI is a really great example of Oregon honoring that community commitment. And I want to make sure that we continue to see this program remain strong and grow.
Thank you. How would you prioritize state funding, including funding that is matched with federal dollars, such as Medicaid, for services to an increasing senior and people with disabilities population?
Yeah, this is a good question. We have, obviously, the demographics of our community are changing. Our population on average is aging, and it's going to require us to bring lots of different kinds of resources to bear on that subject. We're lucky that there are a lot of really good federal programs out there for us to take advantage of. And Oregon has done pretty well, better than a lot of states, at making sure that we use those resources. We need to continue to make sure that our state government is working with our federal counterparts to make sure that we both get access to those resources that are already there, but also communicate with them to help them understand how we need to grow or change those resources. What new sorts of things do we need? What aspects of care are the existing programs not covering? Because I think that's something where our state government has a really good, important role working with the federal government to shape those programs. In terms of resources that we control ourselves as a state, again, we're doing a pretty good job, but there's a lot of work to do. Taking care of our communities is my priority. That is the different ways that plays out that is my one priority, is taking care of our communities. So I will absolutely continue to make sure that we focus our resources on that in every way possible.
Thank you. During this time of increased risk of homelessness and food insecurities, what will you do on a state level so that seniors and people with disabilities no longer face a lack of accessible, affordable housing and receive appropriate nutrition?
Sure. The affordable housing part, I'm going to take those sort of separately. Part of things is, like I said, that's been one of the just consistent focuses for me, and something that I'm hearing from all parts of our community. We, in the wealthiest country in the world, nobody should be homeless. Nobody should struggle to keep a roof over their head. We can make that a reality. We need to make sure that we're investing in all aspects of our housing system. The housing market is complicated because all parts of it are connected. If you have a deficiency in one part, that distorts the prices for other parts. People who are stable in their homes for 2 decades can still be priced out if we don't have enough workforce-oriented housing. That's the part that's growing the fastest. Our needs for workforce-oriented housing in particular, and to a lesser extent, low-income housing, are really growing fastest. We need to make sure that we're investing in those so that, A, people who are seniors or folks with disabilities who fall into those categories have the opportunity to attain affordable housing, but B, make sure that folks who are in something that appears stable aren't disrupted in that. They're not pushed out of their houses, out of their homes. On the nutrition side of things, again, we're the wealthiest country in the world. Nobody should be going hungry. We have the ability to do that. We have existing nutrition supplemental programs. We need to make sure that those remain strong and that we grow them. We need to be continually evaluating as our demographics change, as our population ages. We need to be continually evaluating those programs to make sure that year after year, they're meeting the needs that we have. This isn't a situation where we can say, we've done a supplemental nutrition program, job done. We need to continue to watch this and make sure that those programs are meeting the needs year after year. I think that's an area where maybe we haven't done the best job, and we need to focus some additional attention there. I think these are achievable things. We live in a state that our economy is growing. We have the resources to do this. We just need to focus and decide that this is a priority. And for me, this is a priority.
Thank you. What would you do as a legislator to address the behavioral health issues that have been brought on by health issues and isolation related to the pandemic?
Yeah, this is really part of a much bigger question. Our mental health situation in Oregon is very poor. According to Mental Health America, we are 47th in the nation for adequate access to care to meet the needs that we have. That is not acceptable. And that's an average for lots of individual communities, particularly in rural communities, like a lot of my district. That situation gets even worse. There's 2 big parts to that. On the one hand, there's a question of affordability and access to care from a financial perspective. We need to make sure that our insurance programs, either public insurance or what we mandate for private insurance, covers these services better than we're doing today. Today, we treat them as sort of a different thing. We have sort of a healthcare system and then a mental health system. That's not appropriate. We need to treat those much more similarly and make sure that we're giving mental health services the attention that we do a pretty good job on physical health services. So part of that is just a funding question and a requirements question. That's more straightforward. The legislature has not done as much as I feel like they should there, but what to do, we sort of know the answer to that question. But that's only half the question. The other half is access to care. Even if you have insurance that will pay for it, A lot of communities don't have the providers that they need. That's a little bit more complicated. That deals with how are you getting people to train in rural communities, especially? How do you get people to make the choice that that's what they're going to do for their career when they have, all of medicine or all of behavioral health? How are you going to get people to invest in that? There are solutions there. They're a little bit more complicated, but there are solutions in terms of how we fund residency programs, how we do reimbursement for these services to try to encourage people to go in them. Because even if you have all the money in the world, if you don't have somebody in your community or in a place you can get to that will provide the services you need, it doesn't do any good. So we really need to be taking a broad look at both of these things and making sure we solve both halves of this problem.
Thank you so much. We've been visiting today with Anthony Sirachi. He is the Democrat candidate for House District 31. Thank you for joining us today for this interview with Anthony Sirachi, the Democrat candidate for House District 31. Thank you so much.
Thank you for having me. It was a pleasure to be here.
I want to thank the candidates on behalf of the members of the Senior Advisory Council and the Disability Services Advisory Council of Northwest Senior and Disability Services for attending our candidate interviews. Copies of the interviews can be checked out from Northwest Senior and Disability Services by calling 503-304-3451. Again, that number is 503-304-3451. We hope the information that has been provided will help you make informed choices when you vote. The opinions expressed here are not endorsed by Northwest Senior and Disability Services. For more information or to get connected to services provided by Northwest Senior and Disability Services, please call 1-866-206-4799. Again, that number is 1-866-206-4799. The advisory councils for Northwest Senior and Disability Services would like to thank Capital Community Media for the production of the forum. Thank you for watching.